Hello, my name is Dr. Nagallo. I am a graduate of the SCNM, now Sonoran University of Health Sciences, class of 2017. I'm a licensed naturopathic physician in the state of Arizona, and this month marks my 5th year in clinical practice. And so I'm so happy for this opportunity to share with you about naturopathic medicine and all the things that you can do with a doctorate in naturopathic medicine. I've broken this presentation into 3 parts. First, we'll talk about, or I'll share with you, what my journey has been like to naturopathic medicine. Of course, I'll speak to the principles of naturopathic medicine and how this approach to patient care differs from some of the approaches that you may already be familiar with. And then we'll end with the career possibilities that are at your fingertips with a doctorate in naturopathic medicine. So, without further ado, we'll start with my journey. Would you believe me when I say that I didn't always know that I wanted to be a naturopathic physician? A big part of that was because I didn't know that this approach to medicine existed. I started out my academic career interested in academic research. It's the reason for why I chose to pursue a bachelor's of science in molecular biology, which I earned over a 4-year period at the McMaster University located in Hamilton. Part of my degree was to complete an undergraduate thesis, and I spent my entire last year in the Juliet Daniel lab, which is pictured here. This picture is to date, so these are the current members of the Daniel lab. I am no longer in this picture because I spent time at this specific station. This was my station many, many moons ago. I learned a lot about myself during my time in this lab. I learned that I truly had a passion for science, but I also learned that I really enjoyed being around people. And the thing is, when you spend so much time in doing cell cultures and running PCR tests and Western blots, you feel that deficit with being around people. And so I graduated from McMaster University a little unsure of what was going to come. At that time of graduation, I had already applied to several master's programs in the Greater Toronto area to pursue this dream of becoming an academic researcher. I wasn't quite sure that I wanted to do that, though. I felt that something was missing. And after graduating with my bachelor's of science, I had this wonderful opportunity to help build a school in rural Kenya. One of my dreams as a little girl, because I was such a big fan of The Lion King, was to be able to see a zebra in the wild. And so when this opportunity came up to help build a school in Kenya with my honors society, I jumped on it. This picture here is one of me and my group. I clearly stand out because I have that light blue shirt on. And I was fascinated and intrigued by how these people use the world around them to treat common ailments like a stomach ache or a runny nose, which I now chart in medical practice as rhinorrhea. When we were there for 6 weeks, I'll reiterate that we were in rural Kenya. So the nearest hospital was a 3-hour bus ride away. And so something that was running at the back of my mind was, well, what are we to do if one of us got sick? And sure enough, my friend got sick. She had this really terrible case of gastroenteritis. And what I saw in response to her illness was probably the most pivotal experience that led me towards naturopathic medicine. We didn't have to get on a bus ride to go and travel to the nearest hospital. We were living with the locals. That was part of the experience, is to experience a different perspective, to see a different part of the world, and to experience what it would be like to live out of our comfort zone. And we watched the local medicine man use plants to treat my friend's gastroenteritis, and it was so effective. I came back home wanting to learn more about this field of botanical medicine. It took some time, but then I decided that I really was interested in all of this. And so I withdrew all of my applications to master's programs. And then I continued my training and education, this time in the psychology arena. And so I earned my bachelor's of arts in psychology. I had spent a lot of time in the lab the 4 years prior, that I thought, if I'm going to pursue a career in healthcare, it would really help if I learned how to understand people and behavior. So this is a lecture hall at the psychology building of York University, where I spent 2 years. And then even after that, I wasn't quite sure what area of healthcare I wanted to dedicate the rest of my career to. There are many fields in healthcare, as I assume you're quite familiar with. And so at the advice of my father, a very, very wise man, he suggested, Chriselle, why don't you work? Reasonable suggestion, right? I had spent a lot of time in the academic school world, that it may be worth experiencing what it would be like to work. So I was offered a position as a regulatory compliance coordinator at one of the leading food manufacturers in Canada. I was a part of their quality assurance department, where I was tasked with reviewing and revising marketing claims, ingredient lists, and nutrition facts tables. I share this with you because this experience actually is another reason for why I continued on in naturopathic medicine, because one of the things that we talk about with our patients is what they put in their mouth on a daily basis, which is their nutrition. At some points, I had decided that I wanted to lead a patient case. And this is essentially what eliminated nursing school and many of the allied health professionals. I do know and think that every healthcare professional has a place in this healthcare system. I just knew it wasn't the right fit for me. So this led me down the path of becoming a physician. And I did what I recommend to all prospective students now who ask me about naturopathic medicine, and that is shadowing and observing physicians in their element. I spent about 20 hours shadowing an allopathic medical doctor, an MD, another 20 hours shadowing an osteopathic doctor, a DO. And then I spent quite some time shadowing a naturopathic physician who may carry the credentials ND or NMD, depending on which state they hold their license. And I'll share with you the key observations that I gathered from my shadowing experience. I learned that allopathic medicine My colleagues in the MD arena are especially skilled at acute and emergency care. They're also very, very good at utilizing pharmaceuticals, medication, and surgery to intervene in acute cases. I am somebody that really enjoys sleep. I'm also somebody that really enjoys personal time. And so, with how I envisioned my future life, I could not imagine standing in an OR for long periods of time or being on call when I would be with family. And so, for this reason, it was simply a pragmatic one. I decided that the MD route was not the best fit for me. As I was searching more about types of doctors in healthcare, I was really excited to come across the osteopathic philosophy because in the literature, I saw the terms holistic medicine, which very much resonates with who I am as a person, as well as how I would want to be treated, or how I would want my loved ones to be treated should they ever become chronically ill. I am so glad that I shadowed osteopathic doctors because I learned that there is a lot more than what initially meets the eye. They practice, according to my observations, very much like our colleagues with the MD credential, really skilled at acute emergency care, maybe to some degree, some chronic illness, really skilled at surgery and medication. But I was quite disappointed by the lack of osteopathic manipulative treatment, which I learned through interviewing several doctors, several DOs, that it is taught in osteopathic medical school. However, of the 5 DOs that I shadowed, only one actually incorporated OMT in their practice. So the DO route wasn't the right fit for me. And then serendipity would have it that I would encounter naturopathic medicine through my best friend who grew chronically ill after a severe car accident. She was recommended surgery after surgery without significant improvements, and her life and health completely turned around for the better after seeing a naturopathic physician. I felt lucky to be able to observe what a naturopathic doctor does by treating my friend. And we all know what I ended up pursuing. So this is a picture of me shortly after white coat ceremony. During my time at SCNM, now SUHS, white coat ceremony, where we are given our white coats for the first time as a milestone event. It basically marks the start of the clinical training years. This was after our second year. We had just sat for our first set of board exams, still waiting for results. And we were pleasantly distracted by the excitement of wearing our white coats for the very first time. I ultimately decided on naturopathic medicine because it truly was a whole and is a whole person approach to medicine. As I dug deeper into what naturopathic medicine is about, I came across the 6 principles. And when I learned about the 6 principles, this was really what sparked me to go through the application process. And well, you know, the rest is history. And so I encourage you as I walk you through each of these 6 principles, if you find yourself checking the box, so to speak, it may be an indicator that naturopathic medicine may be a good fit for you. So without further ado, first, do no harm. In an effort to get our patients better, we want to do it in a way where we don't make them worse in the process. This is a principle that we share with our allopathic and osteopathic counterparts because it is a part of the Hippocratic Oath. The second principle is the healing power of nature. We, whenever possible, look to what's available in this world to help us treat disease. Next is identify and treat the root cause. And this is what fuels me every single day in clinical practice. Naturopathic medicine is a great fit of an approach for patients who have chronic illness. A big part of my practice is treating chronic illness. And it's not uncommon for me to meet patients for the very first time and for them to be on more than 10 different medications. And one of the first questions I ask them is, after being on 10 different medications, are you feeling better compared to when you are not on all these medications? And many of them will say no. And what's frustrating, their words, not mine, is whenever they present with a new symptom, and we will surely see that the longer a patient is on a medication, because we start seeing the side effects of chronic pharmaceutical or long-term pharmaceutical use, the solution that they're often given is to be put on another medication. So you see, it's really easy for a list of 10 to become a list of 20. My goal, and this is what I tell all my patients, is to figure out what's at the root of your condition. Because when we find that and treat that, then there really is no need to be on 10 or 20 different medications, and you will feel better. A specific case comes to mind, so I'll share this with you. This is a 32-year-old female patient presenting to clinic with chronic dermatitis. Dermatitis is inflammation of the skin. I'll spare you the specific locations that these lesions appeared on the patient, but they generally are these lesions that are erythematous, so red, swollen, and often hot to the touch. These are basically named some of the cardinal signs of inflammation. And so I asked her, well, have you sought medical treatment for this already? She said yes. And then she proceeded to share with me that every dermatologist that she has seen, she's basically gotten a second, third, fourth opinion, has prescribed her a different version of a corticosteroid, topical corticosteroid, a cream that's designed to reduce inflammation. The thing with corticosteroids is it will decrease the appearance of the lesion upon application, and it's typically prescribed in 2-week intervals. What patients will soon report is after they stop applying this topical corticosteroid, this lesion, this dermatitis will come back. And so, because my goal is to identify and treat the root cause, I'm looking for other affected organ systems that may be the root cause of the inflammation that is presenting at the integumentary system. In other words, the skin. There is a strong correlation between what is happening in the gastrointestinal tract and the manifestations that we see in terms of symptoms at the skin or the integumentary system. I'm going to quote Hippocrates, the father of medicine, one more time. He was the first to say that all disease begins and ends in the gut. This is especially true for this patient. I worked up her case, ran a series of gastrointestinal tests, recognized that there was, or diagnosed her with a case of small intestinal bowel bacterial overgrowth, which is essentially an imbalance of gut bacteria in the small intestine. Once we treated that, I followed up with her 1 month after treatment, and I asked her, have the rashes come back? Keep in mind, she had not been applying this topical corticosteroid. And she, with a smile, pleasantly announced, no. So this is the power of identifying and treating the root cause. The fourth principle of naturopathic medicine is physician as teacher. If identifying and treating the root cause is what fuels me in clinical practice, the principle that I hold near and dear to my heart is physician as teacher. The word doctor is derived from the Latin docere, which means to teach. So it is a doctor's job to teach. And when I talk about how I've used my degree so far, I will talk more about how I teach my patients in the clinical setting on a one-on-one basis about their health, but I also have the opportunity to teach future healthcare professionals in the academic setting. The fifth principle is treat the whole person. We know that the human body is a complex system comprised of multiple organ systems, ideally working synergistically and synchronously with one another. And so when a patient presents with anxiety and depression, my go-to is not necessarily a prescription for an anti-anxiety or antidepressant. I look at the whole person. So I'm looking for signs or external triggers like extra stress at home or extra stress at the workplace and/or extra stress at school or some sort of training environment that may be affecting the mood of my patient. I'm also making sure that organ systems that have to do with stress resiliency, like the adrenal glands, they're able to keep up. I'm also looking for a balance in the digestive system. You may have heard already in some way, shape, or form that the gut is like the second brain. And so it's not uncommon for me to treat the gut and then see an improvement, a stark improvement in a patient's mood and their ability to regulate emotions more effectively. This is the power of treating the whole person. And the sixth principle is prevention. Prevention is the best cure. Had a patient recently establish care with me with a history of parathyroidectomy because of hyperparathyroidism. When they were taking out her 4 parathyroid glands, her endocrinologist had told her that there were multiple nodules in her thyroid. The word nodules doesn't sound very pleasant. It sounds pretty scary, especially to a patient who doesn't have any science background or any medical background. And so, of course, my patient can ask her endocrinologist, what are we to do? What are we to do with these thyroid nodules? And according to my patient, she was told that they were going to watch and wait, monitor closely until the thyroid nodules reach a point where they are too large, and then she would undergo a thyroidectomy, so removal of the thyroid gland. Because the sixth principle of naturopathic medicine is prevention, I am not going to wait until the thyroid nodules are large enough that she would need a thyroidectomy. I, as much as possible, want to keep all my patients' parts intact. And so what I started her on is an iodine protocol because studies do show that there is a strong correlation between lack or a deficiency in bioavailable iodine and the presence of thyroid nodules. 2 months after starting this protocol, an imaging study reported a 30% decrease in the size of these thyroid nodules. So prevention is the best cure. On this next slide is the therapeutic order. The previous slide had the 6 guidelines that we look to as naturopathic physicians that essentially differentiates our approach from our allopathic and osteopathic counterparts. This slide, featuring the therapeutic order, gives you an idea of how we would go about making decisions for our patients. And generally, what we're seeing here is we start from the least invasive and then progress to more invasive therapies. I'm going to highlight what's at the bottom of the pyramid because it's at the bottom for a reason. This is establishing the foundation for optimal health. This is where I talk to patients about how well they're sleeping, how well they're eating, and how well they're moving, if they're moving at all. Because without quality sleep, quality food and nutrition, and quality movement, it is nonsensical to expect the body to be working optimally. Now we're going to move into the third part of my presentation where we discuss what we can do with a degree doctorate of naturopathic medicine. So this is a picture of me shortly after graduation, almost 5 years ago now. So I am due for an update. And on the slide is our highlights of my career milestones so far. So I essentially divide my time between clinical practice and teaching. I started my career about a year ago in a family private practice in Tucson, Arizona, Nature Cure Family Health. After a year with Nature Cure Family Health, I returned to Phoenix because I got married, and I joined Phoenix Anti-Aging Clinic, a private practice in Ahwatukee, which is near South Phoenix, as a naturopathic physician. And since then have progressed into the role of medical director for this practice. In this role, I oversee the care of all our patients. I also communicate closely with the practice owner who does not have a medical background with respect to conducting ethical medicine, as well as making sure that our patients are getting the best possible care. When I'm not in clinical practice, I teach. I currently hold the position of assistant professor at the Chamberlain University, where we teach pre-nursing students. I teach all of their anatomy and physiology, as well as run their science lab. And when the opportunity presents, I also hold adjunct faculty positions at these institutions in the Phoenix Valley, where I can teach, or where I'm asked to teach, anywhere from anatomy and physiology, pathophysiology, microbiology, psychology, and human development. And when I can, I always entertain the opportunity to give back to my alma mater, Sonoran University of Health Sciences, as an admissions panelist. So I sit on the admissions committee and interview prospective or applicants to the doctorate of naturopathic medicine program. When time presents, I do some consulting work, more recently, medical consultant for a telemedicine company based in Scottsdale, Arizona, called NITEC Medical. Was also recently recruited as subject matter expert for the National League of Nursing, where we are tasked with writing questions and creating instruments and tools to gauge the success of future nurses in this field. And then as physician advisor to a nutraceutical company, Mountain Peak Nutritionals, which is currently headquartered in Beaverton, Oregon. In my clinical practice, my area of focus is in hormone health, women's, and to some degree, men's. I have a lot of success treating digestive issues, and come along with that are autoimmune disorders. In naturopathic medicine, there are a select number of what we call board certified specialties. Naturopathic oncology is one of them. Naturopathic endocrinology is another. Most of my colleagues may not declare a specialty, rather have a clinical area of focus. And if you think that everything that I've listed with what I do with my degree was the be all and end all exhaustive list, it is not. There are many other things that you can do with a degree in naturopathic medicine. What I haven't covered yet is research, and I believe you'll be hearing from my colleague, Dr. Keely Puchalski, who is very heavily involved in research. So I will defer all that conversation to her. Some of my colleagues are authors and really active in social media, educating the masses about what naturopathic medicine can do for overall health and wellness. Corporate wellness is one that I'll speak to because it is a growing area in healthcare. We are learning through studies that corporations are interested or becoming more interested in maintaining a healthier workforce. So bigger companies select, I can think of a few already off the top of my head that are Fortune 500 companies. They have what we call corporate wellness programs. They have these programs allow access to employees. They allow access to fitness training programs, mental health support programs wherein they can monitor how they're doing with their metabolic health. I can go on and on. The bottom line is that corporations are quickly cluing in to the following, and that is a healthier workforce makes for a more productive workforce. I've entitled this presentation, A Fulfilling Whole Person Career. To be a whole person and to remain a whole person throughout all stages of life has always been something that's been near and dear to my heart and important to me. And so it was really important that whatever career I chose would allow me to continue to be a whole person. One of the things I haven't shared with you yet about the decision to become a naturopathic doctor was that I always wanted to also be a mom. And I wanted to be the type of mom that was present for my kids whenever possible. It's one of the reasons for why I never really liked the idea of being on call. So on this slide, I'm sharing with you a little bit about my family. This is my husband, Charlie. My favorite photo of him because he used to work in an anatomy and physiology lab. So here he is posing with an articulated skeleton, and he is shaking the hand of another articulated skeleton. And on the right side of this slide is my now 2.5-year-old son Ronald, and our 3-year-old rat terrier Louie. We make it a point to travel because we love traveling and to spend quality time with one another. And this career in naturopathic medicine allows me to work a flexible schedule and to balance work and my personal life to the best of my ability. While it is a never-ending balancing act, it is part of the job and part of the decision to become a naturopathic doctor, and I wouldn't trade it for anything else. Thank you so much for taking the time to visit my alma mater. I hope you have a wonderful tour of the facility. I know you're going to meet some very wonderful people along the way. This slide is entitled Question Slides. I unfortunately will not be taking questions due to the fact that this is pre-recorded. But if you have questions, please feel free to reach out to your admissions rep or someone who is a part of the admissions team, and they will help you get in touch with me. So again, thank you, and I wish you all the best in whichever healthcare career that you decide.